Okay, to be fair, one study that actually showed the benefit from brand name, it's an industry-sponsored study, so there might be some conflict of interest, but I want to look at these percentages. So those people who were receiving Synthroid, that's one of the brand names, 78% had normal thyroid function, and those who on genetic, 77%. So statistically, there was a significant difference. So mathematically, yes, there is a benefit from brand name, 1%. So even if you trust this study, you have to treat 100 people with brand name levothyroxine to see some benefit. So that one patient will benefit from it. Okay, a little bit on the costs. You can get, even if you don't have an insurance, you can just go and show your prescription. You'll get generic supply, 30-day supply of levothyroxine for $4 in Walmart. If you want to be on a Synthroid and your insurance won't cover it, you'll pay $25 if you participate in the AbbVie program, which will cover part of the cost. And if you want to be on the newest brand name, which is Thyroxine, you will pay $60. If your insurance covers it, then you're good. Then sometimes there is no cost at all, even if you're on a brand name. But most insurance companies would only cover generic. So one frequent concern that I have about brand name, that it might be a cleaner medic preparation. There's less fillers, there's no gluten, there is no lactose in there. So if you go on a website for the Thyroxine, which is one of a newer brand names, then they will show a long list of stuff that might be in the generic pill, including gluten, lactose, and dyes. And on the right, this is what's true in those pills from the insert for generic levothyroxine. So there's no gluten in your generic levothyroxine. You're safe even if you have a celiac disease.
On the subject of gluten, is there a benefit to going on a gluten-free diet, and might that help you with absorption?
Yes, if you have a celiac disease. And a celiac disease is a very specific diagnosis, which is done usually by a blood test. So if you have positive antibodies, which are diagnostic for celiac disease, you absolutely should be on a gluten-free diet. If you just like to be on a gluten-free diet and you don't have a celiac disease, there will be no difference.